to It's Your Case, presented by VetCity.com. I'm Virginie Barberet, your radiologist on demand for this week. Today's example is a 6-year-old male-neutered large crossbreed dog with a chronic right hind lameness. Once you have reviewed the radiographs using your systematic approach, then you're ready to watch this video. Now, I will highlight the most important findings for the stifle in this case. So, first of all, this case shows some quite severe soft tissue / fluid opacity in the region of the stifle joint that we can see here again like last week with a loss of visibility of the infrapatellar fat pad, which is a radiolucent triangle normally occupying most of the cranial aspect here of the stifle. So you can see that at this level there is a lot of soft tissue fluid opacity displacing this cranial fat pad cranially. And there is also quite a lot of soft tissue fluid opacity at the caudal aspect of the stifle here that you can see, and quite a severe bulging there, displacing the fascial planes caudally. So this is the first feature of those radiographs. The second feature is the presence of new bone production. Some of this new bone production is a bit smooth, like here on the distal aspect of the patella or here on the fibulae. But there is also some quite irregular new bone production here at the caudal aspect of the tibia, here definitely on this medial aspect of the tibia, and also a bit irregular, faint new bone at the level of the distal femur. So this new bone, the fact that it's quite irregular, it's definitely showing the sign that it's quite active new bone, and sometimes what we call aggressive new bone production, which is quite rough in aspect compared with smooth new bone production that we usually see in case of osteoarthrosis, for example. And then the last feature of this case is also the presence of radiolucent lesions. So here in the subchondral area of the tibial plateau, you can see here also a bit of sharp edges of this subchondral lesion here. And we can also see some in the new bone itself, which appear a bit more lucent, and you see all this mottled appearance. So this would indicate, as you can see this radiolucency here as well on this distal femur. So those would indicate some subchondral erosions or lesions. So that would be another aggressive sign of aggressiveness in that joint. And you can see that it would be polyostotic, not affecting just one bone, but the tibia is affected, the femur is affected, so that would be classified as a polyostotic aggressive disease centered over a joint. Something that I didn't mention before is also that you can see that the proximal tibia here, for example, appears quite sclerotic and patchy, but that's probably because of the superimposition of the surrounding heterogeneous new bone that we see here. So overall, all those features combined, as I said, are more the sign of an aggressive process in that stifle. And when we mean an aggressive process, it's something with some osteolysis involved, usually. And that would either be due to neoplasia. In that case, because it's centered over a joint and there is quite a large soft tissue component, we would think more of a joint neoplasia, like a synovial cell sarcoma or an histiocytic sarcoma. Other differentials eventually for subchondral erosions like this would be to have septic arthritis or to have an erosive immune-mediated polyarthritis, for example. But that would probably be less likely in that case because we had only that joint affected. So that's it for this case. Be sure to review the full report associated with this case. Thanks for listening. And remember, it's your case, so please post your questions on social media. Bye.